Welcome to Shades of Radiology. This is Dr. Nikita Mary Baby. Today I would like to show you an interesting case. In fact, I call it the familiar stranger case. I call it so because it is a familiar case which is occurring in a strange clinical setting. So, this was a 3-year-old girl and she was born to a non consanguineous marriage. She presented to us with progressively delayed developmental milestones. She was delivered at term via normal vaginal delivery with an uneventful perinatal period. There was no perinatal hypoxia, birth trauma, or an ICU admission. So these are the sequences. The first sequence on the right side is T2 weighted sequence, and the second one is flare sequence. As you can see, the T2 sequence shows symmetrical T2 hyperintensities, as shown by the blue arrows. These areas were hypointense in T1 sequence, and the characteristic finding is subcortical, bilaterally symmetrical anterior temporal lobe cysts. This is appreciated in the flare sequence. Clinically, the patient had macrocephaly. So, this is the characteristic radiological finding bilateral anterior temporal lobes along with uh, symmetrical T2 hyperintensity. Now, what differentiates this from other leukodystrophies is characteristic sparing of deep white matter and cerebellum in early stages. Clinically, this patient will present with macrocephaly, and this patient will require serial MRIs as this condition is associated with gradual cerebral atrophy and the cystic spaces that we saw in the anterior temporal lobe will enlarge over time. Now, this is a genetic disorder, the pattern of inheritance being autosomal recessive, and it is commonly linked to Agarwal community in India. The gene isolated is MLC1 gene, which is on the chromosome 22. The patient presentation age ranges from birth to 10 years of age, and the common symptoms with which the patient presents will be increasing head size, learning difficulties, spasticity, ataxia, and seizures. Now, this patient was from Kerala, and the patient was a Keralite by ethnicity. So, since most of the cases in literature are described from North India, the index of suspicion was very low. In fact, this patient was first diagnosed as periventricular leukomalacia, but the clinical history did not match. So a reevaluation was done, and we suspected von de Knapp disease. The patient was sent for genetic analysis, and it came out to be von de Knapp disease. So the strange clinical setting here is this ethnicity. So while most of the cases are reported from North India, this was a case from South India, and because it is relatively rare, the index of suspicion was low, and the patient didn't have the correct diagnosis initially. So the take home message is, whenever you see subcortical cysts and eufiber involvement and white matter swelling, this entity, von de Knapp disease, should come in your differential irrespective of the ethnicity. Thank you.